That was around 2.5 years ago that coronavirus struck in the UK, and for a proportion of those who succumbed, the after effects have never really gone away, leading to what's now known as long COVID. To help those suffering, Merseyside has set up a long COVID and treatment and assessment service. Well, Dr. Phil Cumberledge is a GP at Vauxhall Health Centre in Liverpool, and he's part of the team. He explained to our reporter Mark Geyer how doctors define what is and what isn't long COVID.
We don't really know 100% what it is, other than people have it. And essentially, we try to give a definition to make it easier for us to identify who's got it. And it's when you have symptoms for more than 12 weeks after having an infection of COVID-19. Now, almost everybody gets better quite quickly from COVID-19. Some people get symptoms going more than 4 weeks, which is unusual. But when it goes past 12 weeks, that is what we call long COVID. So the symptoms are quite varied, really. And there's a couple of hundred symptoms that people have described when they've talked about their long COVID. I mean, the most common ones are fatigue, brain fog, shortness of breath, pain, palpitations, dizzy spells, all sorts of different things that, people describe. And often you won't see anything on that person. So the person will look okay, blood tests will be normal, x-rays will be normal, and you'll be left as a doctor trying to figure out what's going on. So that's why it took quite a while, I think, for people to the medical profession to really recognise what long COVID is. Finally, I think now people are starting to recognise it's a real problem.
But I suppose it's still very much in the discovery stage. You're still researching this because it's so new. And at the moment, you don't know how long COVID is because it's not that long since people may have contracted it. So we don't know if it's 3 years, 4 years or a whole lifetime.
Yeah, exactly. The ONS are keeping a track of people who are diagnosed with long COVID. And there's 400,000 people at the moment in the UK who've had symptoms for more than 2 years. Around 2 million people with symptoms who have symptoms for more than 4 weeks. 750,000 who've had symptoms for more than 12 months. So, a good few 100,000 people there at least have had symptoms for 2 years. And to put it in perspective, if you look at conditions like ME or chronic fatigue syndrome, there's probably about 250,000 people in the UK with that diagnosis. So already, long COVID is exceeding that condition. So it's a big problem, not just obviously for that individual, but also for communities, for workplaces, and for the NHS as well.
So for people like yourselves or anyone entering the medical profession now, it's going to be a big thing. It'll be something that we part of the textbook, almost the training.
And that's part of what we're trying to do in our service, is try and get the education out there. So doctors, health professionals recognise people who've got long COVID because it's not going anywhere.
So can you tell us a bit about Merseyscare's Tier 3 long COVID assessment and treatment service?
This has been set up to try and help people long COVID. It's been running since November 2021. We are accepting referrals from GPs. The idea being that we can offer some support for patients who've got long COVID. The symptoms vary in the severity of long COVID. So some people have symptoms that are quite mild and are probably managing on their own, not even seeing their GP. Or they may just see their GP for a bit of advice. So we're looking at people who need that extra support, who are struggling with their day-to-day living, maybe struggling to get back to work, and they get referred to us. They're seen by various members of a multidisciplinary team. So you've got myself, matrons, physiotherapists, occupational therapists. We have access to psychologists and pulmonary rehab. The idea is trying to get people back on their feet really as best we can. The other thing we're trying to identify is things that we can do something about. So there's no defined treatment for long COVID at the moment, but about 50% of patients who have long COVID have autonomic dysfunction, which is a condition where your nervous system, which controls lots of different things, but particularly things like pain, heart rate control, temperature control, sweating, all these sort of conditions, these things you don't have to control yourself and it's done automatically. They don't work properly in long COVID. So we're trying to identify patients who have those sort of conditions, particularly a condition called POTS, which is postural orthostatic tachycardia syndrome. And a lot of people on COVID have this, and they're very unwell with it, but it can be treated with simple medication. So we're trying our best to identify these people, give them some support, get their medications started, get it all help from their GP, and we can get people back on their feet as best we can. If we can't do that, at least we can give that patient, that person, some validation. One of the things along COVID is the recognition of it being a real illness, and that's what we hopefully can do and offer some support for these people.
Finally, just to clarify, I can't come to you directly. This will be via my own GP will decide whether I shall be referred to you. So the service is there, but I'm presuming that all the GPs in the city region are aware of what you do and you're there, but it's through them. You're not a direct service.
Yeah, so you can't be referred to us directly. You've got to go to your GP. That's your first port of call. Discuss your symptoms. Your GP, his job is really important here to make sure you have got long COVID. So long COVID is a condition of many, many symptoms. Those symptoms could be down to something else. Your GP needs to check to make sure there's nothing else that's going on that could be causing those symptoms that needs to be treated in a different way. So your GP might send you for some blood tests, maybe send you for an X-ray, maybe send you for an ECG to check your heart. If those are all normal and the symptoms do sound like long COVID, then they can refer you over to us. And we usually see you quite quickly, and we'll give you another assessment and spend time with you and go through things with you and try and offer you as much support as we possibly can.
Some really interesting stuff there. Dr. Phil Cumberledge, chatting with our very own Mark Geyer, all about the symptoms and the condition of long COVID. It's Sean, it's BBC.